Welcome to DCS Pathways. I'm Kevin Patton, Pathways Counselor for Dublin City Schools. Choosing courses and planning for life after high school can feel overwhelming. The ideas and resources shared here are intended to help students and families with this important process. Well, hi everyone. Thanks for joining us. If you have tuned in live, my name is Kevin Patton. I am the DCS Pathways Counselor, and I am joined today by an amazing group of professionals in all kinds of different backgrounds in healthcare. So if you are someone who's interested in healthcare and you're still trying to figure out what might be a great fit for you, you've come to the right place. We've got some really, really great people here to share ideas with you. So before I turn things over for them to introduce themselves, I do want to point out we have a live chat features on here. So if you have a question or if you think of something that we don't touch on throughout the interview or the panel, please go ahead and just type that in. And if we have some time at the end, we'll do our best to address those questions. So without further ado, I'm going to turn things over to Maddie, who I will let pronounce her last name because I'll probably mess that up.
Hi everyone, my name is Maddie Watovich, is how you pronounce the beast of a last name. I am joining you from Mount Carmel College of Nursing, where I am an admissions and enrollment advisor there. So kind of my path to that role was a little non-traditional. I never really saw myself here. I was originally studying PR when I went to college, but I earned that bachelor's degree. Started out in PR, decided I kind of missed working with students. My parents are both educators, so I found my way back into the education space, and I found that nursing students specifically are rock stars and couldn't get enough of it. So I've been here for about a year now, and I think nursing is a field that I've learned a ton about over this past year, but especially about how many different roles there are in the field of nursing. I didn't know when I first started here that travel nursing was a thing, and it is a really popular job aspiration that I hear from a lot of students nowadays, which why wouldn't you want to do that, right? Travel around the country or the world, and also give back to a bunch of different communities. Definitely something cool to think about. I'll turn it over to Julia if you would like to go next.
Thanks.
Thanks, Maddie. So I'm Julia McGraw. I am an administrative nurse manager at Dublin Methodist Hospital. And so kind of my path to being a manager and working here is my sister was actually a nurse. So growing up, she's 6 years older than me. What younger sister doesn't want to be exactly like her older sibling, right? And so I actually took a mentorship program in high school and was able to mentor her for several hours. And that is really where I kind of decided that maybe I'd want to go to nursing. So I was already early enrolled in Denison for psychology. And the last minute, I backed out. I got a job in a hospital and started working as a PSA, finished my ADN, and then have just progressed up and through and finished my master's. I think the biggest thing about this career that you don't realize is, like Maddie spoke about, is all the different opportunities. There's something for everyone. I love cardiac. I love neuro. I love psych. I like renal. You would not catch me on an ortho floor. Do not like ortho. So there's really something for everyone. You can educate, you can lead, you can work in case management. There's inpatient, outpatient offices, schools, there's corrections. You can do so much and really work in an avenue that fits your life for the moment. So I think that that's the coolest thing. And I didn't realize how vast and just different that was when I first started nursing. So I will turn it over to Jessica, I think is next.
I am Jessica. I'm with Ohio State. I am actually in our College of Nursing for clinical research. So I am an assistant professor for our clinical research programs. We have a master's as well as a graduate certificate and an undergraduate certificate in clinical trials. And I actually, in high school, I thought I was going to be on TV, whether that was going to be broadcasting or acting or something along those lines. Obviously, I'm not doing that, but have had my fair fun moments, passive kind of doing some of that stuff. But I really, actually started out at my bachelor's in communication studies. Loved that degree, very happy that that's what I got. Then got my master's in clinical research and my doctorate in health sciences. And along the way, I worked in the emergency department. I worked in a core infrastructure facility within clinical research, doing a lot of different things. And The wonderful world about healthcare, but specifically clinical research, is just like any other place, there's so many avenues and things that you could be doing. It's really a personal journey of what speaks to you and what your strengths are as to, where you may want to go. We're in a fun spot. I will pass it to Kevin.
All right, thank you. Well, my name is Kevin Weitzel. I'm a pediatric dentist and a small business owner. My path started as a kid. Every time I went to the dentist, I had a lot of cavities, and so I spent a lot of time there. Nobody in my family's in dentistry, but I really had a good experience, and I like working with my hands, and I like working with people. And so I knew at a young age that was something I was interested in. I didn't know that pediatric dentistry existed, or really any of the dental specialties existed. I just thought dental school equals dentist. I went to Miami of Ohio for undergraduate. Miami of Ohio is, pre-medicine, pre-dentistry, pre-nursing. My wife wanted to be a veterinarian, and she's a dentist currently. They all parallel each other really well, and the prereqs are very, very similar. And so as people progress, you see people going from medicine to nursing, from nursing into dentistry, and all of those pathways parallel pretty well. After that, I went to Case Western, to Case Western for dental school. And then after dental school, I went to Ohio State for master's and residency at Nationwide Children's Hospital. Since then, been working for, I guess I'm going on 15 years. But very similar to what everybody else is saying, is there's so many pathways in what I do that I didn't know existed. And a lot of them, and the people I work with, are careers that don't involve going to school for 12, 13 years. A lot of them are high school, and you can do specialty training programs for, 2 and really great careers that are lucrative and fulfilling. So I will pass it on to Jason.
Hello, my name is Jason Davis. I am the Medical Imaging Fellowship Advisor for OhioHealth, a role that I just took on a couple months ago. It's a brand new role, so it's something I'm learning. I didn't actually start out in healthcare, so I ran restaurants for 17 years and decided to go back to school and became a nuclear medicine technologist. I did that for about 6 years, then kind of got pulled back into management, and I've been running a imaging departments for the past 6 years. So I've been in healthcare about 12 years. But through that, it's given me a great opportunity to see all the careers that are out there, all the different things, especially within radiology. There are so many different modalities that you can get into, and different starting points. I'm sure I'll talk a little bit more about that in a bit. So pass it back to Kevin.
Awesome. Well, thank you all so much. I think anybody tuning in or listening later is going to recognize quickly we have a huge variety of things to consider here. And so whatever your interests are, or if you just know you like healthcare, but you're not sure which avenue to take, I love that you're going to be able to learn about some pathways that will give you purpose, pathways that will allow you to support yourself, pathways that will allow you to then redirect later. If you find that maybe you started out as a traveling nurse and you're ready to be more stable because you have a family later in life, there's all kinds of ways to do that. So I think it's just neat to know that wherever you are in your life, there's all kinds of ways to redirect. So I'll jump into some of the questions I've prepared for our panelists. I'm going to start with Maddie. So Maddie, as an admissions professional at a school that specializes in nursing, what are some of the most common nursing pathways at Mount Carmel College of Nursing, and what are some of the ones that students may not be as familiar with?
I think our most popular route to becoming a registered nurse is our traditional BSN program. So that is a Bachelor's of Science in Nursing undergraduate degree. And once you finish that schooling, you then sit for a board test called the NCLEX, and that's how you become, you tack on the RN credentials to your name there. So like I said, ours is a bachelor's program, so typically 4 years right out of high school. Now it doesn't have to go that way. You could certainly, transfer from another institution, or we have more accelerated tracks to get that BSN. Especially, I know some students on here are probably taking advantage of CCP credits. So that 4 years time can certainly be shortened down quite a bit. But we specifically are very specific to nursing. So all your content is kind of built into those 4 years, so that by the time you're finished, you're very well rounded in all the fields and prepared for that board test. One program, kind of a route to a same thing, a BSN degree, that students might not be aware of is we have an accelerated BSN program that we call a second degree accelerated program. So this is for folks who went to school, got a bachelor's degree in honestly anything aside from nursing. So you could be anywhere from a biology major all the way to a communications major. And then you maybe decide a little bit later down the road that you want to pursue nursing. And we just like to say that it's never too late. So whether it's, you're 20 years into a different career and you decide you want to go back, and study nursing, or you finish your first undergrad and decide maybe this isn't the field that you want to do and switch it up. There's, no time that is too soon or too late, but those programs can just be kind of like a year tacked on to your traditional 4-year bachelor's degree, or a year and a half, whatever you prefer. But same thing, you result in that Bachelor's of Science of Nursing degree, then sit for that board test at the end.
No, that's great. I think that's a good thing to know, because sometimes students do finish and then they get out and they realize maybe this wasn't the right fit for me. And it's nice to know that they don't have to go back and do it all over again. You still get credit for the work you put into that bachelor's degree. It's just now it might take you a year or a year and a half, which is a lot more easy to wrap your head around, I think, once you're ready to make that switch.
It's definitely not, starting from scratch by any means.
Yeah. So when you're reviewing applications, what are some specific things you look for when it comes to what makes a great candidate? And maybe even mention anything about specific scholarships that might be available for those individuals.
Yeah, great. I think, for a lot of health sciences fields, but nursing specifically, kind of the biggest piece of the pie is kind of those quantitative metrics. So we look at GPA, we look at your grades in your sciences and maths, those courses that really kind of connect directly to healthcare. So we definitely would like to see that you performed well, gave it a good shot in those classes specifically, but also kind of on the other side of things, we love to see that you have maybe any sort of relevant experience. And this doesn't need to be anything crazy like an internship or anything, but even if maybe you job shadowed at a nursing home one day, or you volunteered doing this, one way or the other, we just love to kind of get that bigger picture about an applicant, especially if it is any way related to the things you hear most connected to nursing, like helping people or, giving back and taking care of folks. Those are really cool things to see, but also things that show us that you have a lot of drive, determination, perseverance. Those are qualities that will need to stick with you in nursing school for sure. No one will tell you it's a walk in the park, but it's certainly not impossible, especially if you keep at it, put some hard work in, and just keep your end goal in sight, but also kind of why you're doing it. We always tell our students to keep their why near and dear to their heart as they're going through nursing school. So anything that shows us those kind of qualities, that's really kind of what we look for. In terms of specific scholarships, though, kind of going back a little bit to those academic metrics, those can get you considered for merit scholarships automatically with us. So, based on GPA, we have a few different ones. It's kind of like a tier system. And we are a test optional school, so you don't have to submit your ACT or SAT scores to apply. But if you do send them in, those can get you considered for merit scholarships. And that's always a good question to ask any school you're considering too, because sometimes maybe the school won't require it, but a certain major might require it. You might see that for a lot of health sciences majors specifically. So just always a great question to ask, and ask them to define maybe what their test optional means, because like I said, it won't hurt you if you submit it, but we can certainly consider you for some extra things if you do.
I think that's great advice, because it is confusing, because while applying to colleges is very similar across the board. They all have their own unique little intricacies and things of that
For
nature. So
sure.
I'm glad you bring that up to ask those good questions, especially to the schools that you're most interested in, right? I think and when you know your why, like you mentioned, it's a lot easier to narrow down that list of schools that would be a good fit for you. I think that's something that we definitely emphasize with our students. All right. So, Julia, I'm going to move on to some questions for you. So, nursing is a labor of love, not always glamorous. For students considering this profession, what recommendations do you have for helping them determine if this career pathway is the right fit for them?
Yes, so nursing is definitely a labor of love, and it is often not very glamorous. So the best advice, and I share this lovingly with everyone and every panel that I'm in, and it was advice my sister gave me when I was like, man, I think I might want to be a nurse. She goes, Julia, there are just smells in a hospital. You're going to need to go work in one. See if you can handle it. Don't waste your time in school if you're going to get out and be like, gosh, I don't like blood, bodily fluids, I don't even like needles. Don't waste your time doing something that you're not actually going to be able to stomach, because there are a lot of very non-glamorous things that you do kind of have to stomach in nursing. And although there are a lot of different pathways in nursing, most nurses at the very beginning of their career do mostly end up long-term skilled or inpatient med surg. So those are kind of the two places that the bulk of nurses tend to start out for their first few years. So anybody interested in nursing, if you think maybe you're interested, get a job in the field. If you are one of those folks that you're like, I know I want to go to nursing school, I think I want to work in inpatient when I'm done, that your goal is to be in a hospital, come work for us. We hire 16-year-olds. We also partner with a lot of vocational schools. We do like the TOLS program. We have folks come in, they shadow. I have people who reach out all the time that are high school students that are just like, I'm thinking of nursing. Can I come shadow? Absolutely. Come put on some scrubs, see what it's about. We go over, then, we can talk about our educational opportunities, all of those things. Definitely getting a job working in nursing. Our unlicensed personnel, we call them PSAs. Like I said, we hire 16-year-olds. So there's very little qualifications that you need to have to kind of start out in that role. And really what we look for in folks applying for that role is a level of maturity. So when you come in an interview, I don't expect a 16-year-old to 17-year-old, 18-year-old to be able to have the most fantastic interview responses, right? You've probably almost never interviewed before. But what I'm looking for is that you can tell me why you want to care for folks. I'm looking for people who have a track record of accountability, because this is a very adult job. You are going to be treated like an adult. You are held to the same standards. You will see things that are not glamorous like an adult. You will see things that are tragic. So a certain level of maturity and accountability are the things that I really look for. So that might be me simply talking about, how are your grades? Do you have late assignments? How does communication with your parents work? Those types of things go a long way for me, because if you're not able to communicate with your teachers, you're not going to be able to communicate with me. And as I said, this is an adult profession. So always encourage folks, get a job, work in the hospital if that's where you're interested. Long-term care does have a little bit more stringent age requirements. OhioHealth did recently just go down to the 16. Reach out, shadow, get involved in a vocational program. All of those sorts of things are really going to gear you if this is going to be a good fit for you. Simply because, like I said, most nurses do start out inpatient med surg. So that is going to be something you will have to stomach for a little bit of time.
I love that. And I think many of our students who are interested in nursing don't even realize they can start doing some of those entry-level roles before they leave high school. And I want this message to reach as many people as possible, because I do feel like, to your point, a lot of people do start programs before they really know if that is going to be a fit for them. And if you've not worked in that setting and you don't know if you can handle some of the things that really are, minimum expectations for those roles, you don't want to start pay a bunch of money for something that isn't a good fit. So I love that you share that. And I've talked to a lot of students that are in medical school or pre-med, and they're doing those entry-level nursing positions, and it's so valuable for them to make those connections and to just value every position that's required for care to be successful for those patients. And then when they do reach those those higher professional roles after their schooling is over. They have such a different respect and just admiration for everybody that's involved. So I think what you shared is awesome for our students to hear. So my next question for you is, OhioHealth has so many critical roles that they're looking to fill, especially in nursing. What are some of these roles that you're looking to fill, and are there tracks that students can take to land these roles that are different from the traditional college process?
Of course, yeah. So within nursing services, we hire about like 4 main roles. We'll hire our unlicensed personnel, which is our patient support assistants. We hire a PCE role, which is a pre-licensed clinical extender. This is somebody that's in nursing school that has typically completed their first year. So these folks are able to do a little bit more than our PSAs. They can practice their IV skills, they can do Foley's, clean dressing changes, those sorts of things. And they are accepted to our fellowship program. So they're going to come to us when they graduate. So we're kind of giving them this increased responsibility so they can practice a lot of those skills, knowing they're going to come to us when they graduate. We also hire LPNs. So even on inpatient, we use a lot of LPNs. I have them on both of my units. And LPN school is roughly 18 months. So you can do that a little bit quicker than you can even just an ADN. And then, of course, our registered nurses. Those are kind of the 4 main things that I hire on my unit. And I know as Maddie talked about, that traditional BSN route, I always encourage folks that, you can work on the floor as an ADN. So I went to a tech school and went back for my BSN. There's different ways. Everybody's life situation is different. Everybody's economic situation is different. Some folks can't afford a 4-year education right off the rip, and that's okay. You're going to be very well prepared in a good 2-year school. There are really great ones, and we have a lot locally to us. I think that's what makes us so unique, is that we do have so many local ADN programs that are very good. Don't be afraid to take that. So just working with what works with your life. So trying not to take on something that is going to stretch you too far, stretch you too thin to where you're not going to be successful. So I love it when I can see. I just recently had somebody that grew from a PSA into a PCE. She's now a nurse on one of my units, and that I love that. I love that we're able to provide and be able to see them grow at every step of the way. And again, she did an ADN route and is back in school for her BSN. So I think sometimes there's that stigma, and I even get it with some of my PSAs. They're like, don't I have to have a BSN to apply here? I'm like, no. Some places really do not require it. So depending on where you're looking to kind of end up, what healthcare system you're looking at, I always think it's a great idea to look at what really their requirements for hire are, because they are different across different healthcare systems. So just keeping that in mind, and that you can start with an LPN and go back to school and still be able to work in inpatient. There's just a lot of different opportunities, I think, now than there was even 5-10 years ago.
I'm so glad you bring that up. Those are the exact types of messages we're trying to make more widespread in our community. I think it's such a college first mentality all the time. And while the majority of our students will go on to college, and it's certainly not the only route. And I think sometimes even to your point, it's more beneficial for some students to get there later and to go do a path that's not as expensive and gets them to working and making sure that's even what they want to do. And now all of a sudden you have an employer that will pay for your bachelor's degree. Mm-hmm. And you end up in a job that's probably a better fit because you didn't choose it when you were 18. You chose it because you were in a setting and you saw all the different roles around you and you were asking questions, being curious, and finding out, wow, I didn't know that was a thing. And now that's what I'm going to go to school for. So I think these are the types of conversations we're trying to make more widespread. So I'm so grateful that you bring that up. So Jessica, I'm going to move on to some questions for you. So I know many students who start out on a pre-med track, they change their plans once they're in college. So sometimes this is because they fall in love with the research component. So do you mind talking about some of the opportunities in clinical research and how students can gain experience in this area, whether they're in high school or after they graduate?
Yeah, absolutely. And I have to say, there are so many instances where we have students who are pre-med or They are very gung-ho. They're going to medical school. And after they started working with us while they were in college, clinical research, they've changed. They came over to the dark side, maybe we will say. But I will say there are quite a few opportunities in high school. Shadowing opportunities are huge. Reaching out to a clinical research unit, asking if you can come shadow and see what they do. They're always welcome and happy to have students come on. So if you're looking for a position, get clinical research assistant roles or data entry roles, ambulatory assistant. Those type of roles are what we call our entry level. So you're able to really start out and learn from the ground up. There are many institutions now that actually only require a high school diploma. That has been something that we've been trying to change nationally for a really long time now, because before it was they always wanted you to have your bachelor's and to have X amount of years of experience. But really, Julia mentioned we need the mature and, students who can go in and talk to patients and families. But you can start out right out of high school in a lot of different roles and have that, capability. I think the thing is too, when you start out early on in clinical research, you're able to find what disease area or what area really speaks to you. I was thankful when I worked in the emergency department, I was able to see that. I was able to see everything. And that really helped me find out what research I was passionate about.
I think that's great. And I love the example of entry-level roles, because I think so many students are excited to jump to the jobs that sound super cool. And I think ultimately where you're going to get those opportunities is when you've been that person who put the work in and they've laid that groundwork, they've built that foundation. They, to your point, were exposed to all kinds of different things, and now they know why they're passionate about the direction they're trying to go. And I think the same goes for even internships. So many students are ready to just go jump into the most well-known companies for internships, and I always tell them it just doesn't work that way, especially in high school. Look for the small opportunities. We've got we're so lucky to be in Dublin and to have the type of industries and businesses and places that want to help kids get experience, especially the ones that show up and are mature and aren't going to embarrass anybody while they're there. And then all of a sudden, once you get that first one and that first entry level role or that first entry level internship, it's a lot easier to land that second one. And by your third or fourth one, that's where the really cool ones start to happen. So I think these are things that we want, again, our students to be thinking about as they're making these plans. So my next question for you is, as someone who landed in clinical research after starting out in a different area, what drew you into the field, and what have you found to be your favorite and most challenging aspects of the work?
Great question. I did. I started out in business and that for many years, and I had an opportunity to move back to Columbus, be closer to home and my family. And I started working at Nationwide Children's, and I thought I was actually going to go get my master's in social work because I knew I loved helping. I loved being with families and patients, and that is what I was more drawn to. And then I started to get involved in clinical research, and what really drew me to the field was I didn't want to be a doctor. Being a nurse scared me because I was going to have to deal with blood, and that just, automatically made me queasy. The thought of it. I loved the idea of discovery, where, you in clinical research, you are working on the front line of new discovery every day, whether that be drug discovery or device discovery. Thinking of heart monitors, where did that start? That started in clinical research. And knowing that I would be helping make a difference in patients' lives was not drawing their blood or opening them up or anything like that, which was really cool, but I just knew for me it was not going to work. Loved that. I loved knowing that I would be helping really, make a difference and make a change. Similarly, why I now am an educator in clinical research is because I want to do just that. I want to help inspire other clinical research professionals understand the importance of the role and how you are on the cutting edge. It is just a little bit different of what you're going to be doing, but you're just as important. My favorite thing has actually been, teaching, but being a project manager in the field. So when I was a project manager in clinical research, I oversaw multiple clinical trials. I loved that work because I was able to be the middleman between our industry, pharmaceutical partners, and then between the site and helping us get set up as a site for those studies. And it was really, really cool. Most challenging aspects of the work that I've done was working in the emergency department in pediatrics and doing some pretty cutting edge trials around seizures and looking actually at tranexamic acid, which is a blood clot stabilizer, kids who have been in traumatic injuries. So that was very challenging from the emotional perspective, but also the trying to train our clinical research team how to navigate those conversations with parents during that time. And when I worked there, I was not a parent, and now being a parent of two are even more things that I would say to a team having to go into a family during that time. But yes, it's a wonderful, wonderful field.
I think it's great. And again, that's one that I think a lot of our kids aren't thinking about. And sometimes you don't realize how much you like research until sometimes college, because that's when you have to research. High school does a great job of introducing it, but certain classes in college, if you're going to be successful, you have to learn how to be a strong researcher. And some students find that they love it. And from that discovery standpoint, right, also there's all these aha moments that happen when you start to learn how to do it well. So I think it's really neat that you share all those different avenues and things that students could look forward to if they decide to check that out. All right. So Dr. Kevin, I'm going to move to you. You and I think we were telling Maddie before, it's hard to believe you and I have been friends for over 20 years. We met each other at Miami University. I know neither of us look old enough for that to be the case, but it's true. And you are the pediatric dentist for all three of my children, and they love you. I know I didn't look forward to the dentist when I was a kid, but every time we go, my kids are so excited because you create such a great culture there, and your office is fun and your staff is nice, and you can just tell everybody there is well cared for by the dentists, and it really makes an impact. So first, I just want to thank you for creating that culture at your practice, and certainly, my kids love you.
Thanks for the kind words.
Absolutely. So questions for you. I know you decided to pursue that specialist track in dentistry by becoming a pediatric dentist. How did you land on that decision, and what were those extra requirements that you would have to do if somebody else decided to go in more of a specialist track?
Yeah, that's a good question. So I didn't know anything really about dental specialties, even like through the first year of dental school. I just thought dental school equals dentist, and that's what I wanted to do. Halfway through, we had a guidance counselor that kind of gets students together and tells you what your options are, and then they have specialists come in. When a pediatric dentist, you work with children, you work with patients with special needs. We go to Nationwide Children's Hospital where we're on medical staff, and we take a lot of our special needs or young children that can't tolerate treatment and do general anesthesia. And I didn't really know that was a career path, but I knew I liked working with children, and I know I liked working with special needs patients. And so that was a good fit for me. After dental school, there are all sorts of pathways. So pediatric dentist, 2 to 3 years additional, and it's typically hospital-based. Oral surgery, you can do really anywhere from, I think, another 3 to 6 years, depending on if you want to get an MD after that and do oral surgery. If you decide you don't like working with teeth, you can become an anesthesiologist and do dental anesthesia. So today at Nationwide Children's, our anesthesiologist was a dental anesthesiologist. So she's not going to actually do anything with teeth for the rest of her career. But all of those require a couple of years after dental school to get, but they are typically orthodontics as well. Any parent out there who has had kids with braces, that's a wonderful, lucrative career that I encourage anybody looking into dentistry to go into. But I followed my passion of working with kids and have been really happy with it. But it was a long track, but I enjoyed it.
That's great. And I think it's nice that students hear about some of these options now so much earlier than when you discovered them as someone who was already determined to go into that field. So I think it's awesome that you obviously landed in the right place for you. And obviously that's what we want for all of our students that are going through Dublin City Schools. So for students who like the idea of working in a dental office but are unsure about the long track to become a dentist or a specialist, what are some of the supporting roles that they may want to consider, and what are the educational requirements of those roles?
Yeah, so a lot of our staff have, there's different pathways that are a lot less time, but provide a great work-life balance and a great income that people don't, often know about. One is dental hygienists, which we have several dental hygienists. Dental hygiene is anywhere from 2 to 4 years after school, where you do a specialty program and get certified as a dental assistant. And it's a great career, something that I would really encourage my kids to get into without hesitation, because it does provide, as you get older, a flexibility in schedule and life work balance to where you can always find a job working the hours that you would like to work. We have many dental assistants who do a program directly from high school, typically, where they become a certified dental assistant. And from that, there's levels of licensure that you can do more and more to become an expanded function dental assistant, which is probably like the nurse equivalent in dentistry, where you're like the right-hand man of the dentist. You can place certain fillings and really have an expanded role in the office. The other one is office manager. If you get into it, and from a front desk business standpoint, our office manager started with us out of high school as a dental assistant, became certified in coronal polishing, cleaning teeth, and then became a front desk. And then ultimately she's in charge of our staff of about 30 people and managing that. And it's a great career that she didn't know that she would find herself in. But I think if you knew that existed, it's a really niche industry. And so really anything in the profession is such a niche industry that it's helpful. And I would, just like I think Maddie and Jessica and Julia said, is shadow and come see what it's all about and see what the different professions are. And it never hurts to do that. And I did a lot of that in high school just to make sure that dentistry was something I was interested in. I did that in dental school at Children's Hospital to make sure that working with kids was something I was interested in. And it's something that I would encourage anybody to do. And Kevin can share my information if you were interested in coming in and kind of seeing what we do. Anybody would be welcome.
That's great, and that's a really nice offer, and I wouldn't be surprised if some students take us up on it.
So we're used to it.
That's awesome. Very great. So, Jason, we'll move on to the questions I've got here for you. So, many students know they're interested in healthcare, but they've only really scratched the surface when it comes to the many different careers that are available. So that's kind of been the theme of what we've been talking about so far. So I would say imaging roles fall into that category of not well known for high school students. So we talk about some of the opportunities in imaging and maybe give some examples of educational pathways that can lead to those careers.
Yeah, so there are a ton of opportunities in medical imaging fields that we have across the system, across everywhere. All of them, for the most part, you can just get an associate's degree. I was just going over some school stuff earlier today, and there are 14 different schools, and we've got 86 different students across 16 hospitals within OhioHealth. There's tons of things going on. So we get everything from the biggest starting point for radiology, especially, is the rad tech or radiology technologist. So that's kind of the basis. They go from there. That's your associates. That's when you get certified, all that kind of stuff. And then you can become a CT tech. You can become an MRI tech. You can go into working in the OR. You can work in the doing ED. There are so many different things that you can do with that. Then on top of that, we've got, like I said, I was a nuclear medicine tech. That's another branch. There's ultrasound, and if you start off with ultrasound, you can go into cardiovascular or echo tech or obs. We'll put it there. So there's a ton of different things you can do out there, and like with my new role as the fellowship advisor, the whole idea there is we're bringing in these rad tech and training them in the advanced modalities, whether it be CT, MRI, or whatever. And that's all something we're doing on the job training kind of thing at OhioHealth. So yeah, there's a ton of different opportunities out there.
And I think that's great. And certainly, again, as students are just exploring options, they like the idea of healthcare. They don't really know what might be the right path for them. I think even just hearing that, hey, there are these incredible opportunities with associate's degrees, because we have students that don't necessarily love school because they don't love the classes that aren't very interesting to them. And all of a sudden you can jump into a 2-year degree that really jumps right into those classes that are tied to what you'll be doing and those concepts that you'll be using on the job. And now all of a sudden you have a different purpose for going to school, and it's a much easier to see, that path to work when it's only 2 years in classes you enjoy versus 4 years when maybe half of them are going to be the classes you don't love. So I think it's great for our students to recognize, even if you mention all those things and they're like, I don't know what any of that is. Well, now they at least have something to go and explore and be curious about, and to know that there's 2-year routes to get there, or there's high school, programs that students can start now to see by the time they graduate which one is the right fit for them. So I love that you share all those.
There's a lot of rotations when you're in school too, as a rad tech. You get to see a little bit of everything as you go through, kind of help you decide what specialty you want to go into.
That's awesome. And I would say the number one thing when I'm advising students on creating that plan for what to do after high school, and for most of them it's college, but what I always tell them is, do not base whatever you choose to do on the name. Make sure you're asking more about how are you going to get the experience that helps you figure out what you're interested in, what that's going to allow you to make those networking connections for people that will help you find jobs, that will give you the experiences that will be the only thing that comes up in an interview in your future. So I think a lot of our kids focus too much on the wrong things when they're creating those lists of schools to apply to. So I love that you're mentioning programs that are really designed to give them that experience, so that when they do make those big life decisions, they know why they're doing it.
Absolutely.
So the next question I have for you is just out of curiosity, and I'm sure there's a big range on this because of all the different things you just mentioned, but what are some of the average salaries and the career progression opportunities for some of these roles that don't require that 4-year degree prior to entering the field?
So I reached out to talent and review, today to kind of make sure that I'm on the same page, and basically what we're looking at for a rad tech right now, $26.39 to $39.59, so up to $82,000 a year. A senior rad tech, somebody that does CT, mammo, MRI, ultrasound, radiation therapist. Once again, there's so many different ones. Those are 3170 is a starting range to 4914, so up to 102,000 there. And then some of our more special nuclear medicine techs, cardiac sonographers, peripheral vascular ultrasound techs, getting a little more technical into those. You're looking at 3392 to 5258, so up to 109,000 a year. You can make some pretty good money, and we've got all kinds of sign-on bonuses and annual bonuses and all kinds of different things that are thrown in there, on top of just the salary portion of it as well.
Well, I think it's great for our students to hear that, and also, once you end up in a career like that and you're making that kind of money, and all of a sudden you're exposed to all of the other specialists that are also supporting those patients and those doctors and those nurses, and you start to realize, well, maybe I want to do that. And now I'm thinking, what if I want to go, I maybe want to go back to school now, and they're working for an organization like OhioHealth. Are they going to have opportunities for tuition reimbursement where they're not even going to have to maybe pay all or any of that tuition for those advanced degrees?
Absolutely. So from day one, when you get signed on at OhioHealth, for a full-time person, it starts $5,250 annually that we'll take care of. And there are certain in-network schools that basically they just take care of it. We don't even have to worry about the reimbursement portion. So that's pretty good. And then the workforce critical roles, so some of the things that we're radiology being one of them right now, nursing also same thing. They also are eligible for the $5,250 a year. If you're not part of that and you're part-time, it's $3,000 a year. But yeah, I personally have taken advantage of it. Julia, I'll bet you have as well, probably, right? Yeah, that's how a lot of us, we got our starts in a certain area, and then we go back to school. Started with my associates in nuclear medicine, ended up getting my bachelor's in healthcare management, and that's OhioHealth took care of that for me. So yeah, same thing. You can do that with any of the advanced modalities or whatever.
I think that's incredible. And obviously college has become so outrageously expensive, and so many families, even those who have done their best to plan ahead and try to save, they start to look at those dollars when the time comes and they are overwhelmed and they can't believe that it's going to cost that much. So again, it's so important for those, students, you can go out and take out loans and not do things like this if you would like to, but please know that these are options too, because it's really nice not to have to pay back student loans. And it's really nice to make your own money that can support a lifestyle that you feel proud of, and to be in a career field where you're helping people and you're continuously learning new skills that the world needs. Like, that's a really good place to be in this life. So as much as you can explore in high school, and we are just loaded with programs to do that, and we have wonderful partners just like the people who are on this meeting right now that are willing to give you opportunities to shadow and to see and to talk to and have informational interviews with people doing jobs that sound really cool to you. It makes it a lot easier to make those decisions, and you start to recognize, oh, I don't have to have it all figured out. I don't have to know this when I'm 17 or 18. I can change my mind, or I can do an entry-level role first, or I can do an associate's degree first. And there's all these things that we haven't talked about enough over the years, especially in our community. So I'm really grateful for all of you sharing this time with us, and I can't wait to go in and share this information with anybody who maybe didn't have a chance to tune in live, because we are just trying to build this library of conversations like this, because we are trying to change that culture in our community in terms of there are really great options out there, especially in healthcare, that most of you aren't aware of. So I can't thank you all enough. I don't see any questions in the chat right now, so I don't know if any of you have something that maybe I didn't ask about that you want to share before we wrap up. Now would be a great time to do that. Or if you have any questions for each other, because you're learning cool things too. Otherwise, we're getting close. We did our great job. We stayed under an hour, which is always my goal with these panel presentations. So does anybody have anything they'd like to add as final words? All right. Well, then I will go ahead and wrap things up for us. You are amazing people doing amazing things in this world, and we're so grateful that you spent this time with us, and our students and families will greatly benefit. So thank you all so much. Thanks for listening. Please do not hesitate to reach out with any questions about the many resources we have in Dublin City Schools related to exploring post-secondary options. My email address is patton_kevin@dublinschools.net. I also want to give special thanks to student intern Cam Williams from the DCS Media Marketing Academy. Cam designed the cover art for the show and will be sharing regular updates via social media. Be sure to follow Cam's posts at DCS Pathways Pod on Instagram and TikTok. Hope to see you next week.